Hi, my name is Jared Horn. I'm a student physical therapist. I'm going to be demonstrating the clinical test for cranial nerve 7. It's the facial nerve. The facial nerve has motor, sensory, and parasympathetic components. Also, it controls the efferent aspect of the corneal reflex. So for the motor, this is going to control the muscles for facial expression, closing your eyes, moving your lips. The nucleus for this is on the pons, and it's the facial nucleus. Sensory controls taste on the anterior 2/3 of the tongue. The nucleus for this is the solitary nucleus, and that's also on the pons. Also for sensation, it's going to control touch, pain, and temperature for the tongue, pharynx, and the skin near the ear. And the nucleus for this is the spinal nucleus of 5, and that is in the medulla. And that also that is the same as cranial nerve 5. And then for the parasympathetic, this is going to control the lacrimal and salivary glands. And the nucleus for this is the salivary nucleus, and that's on the pons as well. So the first test I'm going to demonstrate is the motor test. I'm going to have you do a few facial expressions. I'm looking for symmetry of the face. So the first one, I'm going to have her wrinkle her forehead. Wrinkle your forehead. Good. Next, I'm going to have you close your eyes tight, and I'm going to try to open them. Don't let me. Good. I'm going to have you fill your cheeks full of air and hold it. Don't let me push it in. Okay. And the last one is I'm going to have you bare your teeth. Good. Okay. So it's real important to do the frontalis muscle. That's the wrinkling the forehead. That's going to help differentiate between upper motor neuron and lower motor neuron lesions. Next, I'm going to demonstrate the how to test for taste. What I have are Q-tips and salt and sugar. I want you to hold these cards. One says salty, one says sweet. I don't want you talking during the test. I'm going to hold your tongue out, and I'm going to touch one side of the tongue with the Q-tip, and it's going to be salty or sweet. And I just want you to hold up the card, the appropriate card. Okay? So I'm going to dip it in water so that it'll stick to the Q-tip. Okay, go ahead and stick out your tongue. Okay, good. And you can rinse your mouth out between. I'm going to test each side of her tongue. Okay. Okay, good. So the next test, I'm going to test the corneal reflex. I have a tissue. What I'm going to do is I'm going to ask the patient to look up and away. What I'm going to do is I'm going to touch this to the bottom corner of your eye, and I'm looking for her to blink rapidly. Okay? And look up and away. Let's do that one again. Look up and away. Okay, good. So those are the tests for the facial nerve, which is cranial nerve 7. Thank you.